Let's look at the signs of pregnancy. These are broken down into presumptive, probable, and positive. Presumptive is changes felt by the woman. Probable is observed by the nurse or doctor. Think of a doctor holding a probe for probable. And positive can only be attributed to a fetus. Think, I am positive there is a baby in there. So again, presumptive, think mom. Probable, think doctor. And positive, think baby. Now, presumptive and probable are not a definite diagnosis for pregnancy, where positive pregnancy signs are definite diagnosis for pregnancy. Again, we are positive a baby is in there. Let's look at the presumptive signs. These include amenorrhea or absent of one's menstrual periods, nausea and vomiting, breast enlargement or soreness, and quickening. Quickening is when a mother feels the movement of the fetus in the uterus, but this is not a definite diagnosis of pregnancy because this movement could be mistaken for gas, hunger, stomach discomfort, or fetal movements. So we aren't 100% sure what's causing it, so it falls under a presumptive sign. The reason all these are considered presumptive signs is because they are all felt by the mother and can all be associated with other things besides pregnancy. Now let's look at all the signs of probable. Remember, these are pregnancy signs that the nurse or doctor can observe. You can remember the 3 signs go with probable. These include Goodell sign, Chadwick sign, and Hagar sign. Goodell sign is a softened cervix. Chadwick sign is bluish color of the vulva, vagina, and cervix. And Hagar sign is when the lower uterine segment feels soft. Another sign that falls under probable is ballottement. This is when the uterus is pushed with fingers, the fetus goes up and then returns back down to its original position. You can think of ballottement like a bouncy ball. When you bounce a ball, it goes back to its original spot. Next is a positive pregnancy test. This looks for high levels of the hormone HCG. Now, you're probably thinking that this should be a positive sign of pregnancy, but high levels of HCG can be associated with other conditions such as a molar pregnancy or certain medications. So it falls under probable. Next is positive pregnancy signs. Remember, these can only be attributed to a fetus and it's a definite diagnosis for pregnancy. I am positive that there is a baby in there for positive pregnancy signs. I like to remember these by thinking the baby is heard, felt, and seen. The fetus is heard through fetal heart tones through a fetal heart monitoring device. The baby is felt by fetal movements on an ultrasound, and they are seen by visualization by an ultrasound. Let's look at some of the most commonly tested on points relating to pregnancy signs. Presumptive is changes felt by the woman. Remember, quickening can be mistaken for GI upset or gas. Probable is observed by the nurse or the doctor. Remember, we have the 3 signs. We have Goodell sign, Chadwick sign, and Hagar sign. Positive pregnancy signs can only be attributed to a fetus. Remember, the baby can be heard, felt, and seen. That's all for pregnancy signs.